Hey y'all, I want to go over the importance of reading your signs and symptoms for a scan. So, yesterday, for example, I got a CT pelvis without contrast. So, essentially, you're thinking, okay, CT pelvis, it's probably like a bone fracture, or they had surgery for their pelvic bone. So, it's probably like a follow-up. At least that's what's going on through my head, right? But it's really important to read why they're getting the scan. So if the order doesn't say why, we have to dig, right? Dig for the information. So this person actually came for an inguinal hernia. And you're not going to see that in a bone window. So you know in your mind that you're going to click soft tissue, something for soft tissue. Now there's many options for a scanner, and every facility is different. So go off of what your facility does. But overall, across the plane is inguinal hernia. You're not going to have a bone window. But you should have both a soft tissue and a bone, but you don't have to do all the cuts for the bone, is what I'm saying. So again, every facility is different and every scanner is different. The protocols that are built into the scanner are also different. So if your scanner already builds both soft tissue and bone window into both the CT pelvis without and the CT pelvis with, then disregard this. But just know to read your scanner. But if it doesn't, so essentially, like, let's say it doesn't. So you have on your scanner, there's going to be multiple selections, right? And it's like, which one do I choose for this exam? Well, CT pelvis without is normally, again, for bone, so fractures. It's going to have a bone window that probably does axials, sagittals, and coronals, but it might have a soft tissue of just the axials. So that's okay, right? Because you're getting a bone and a soft tissue of the axials to compare to each other, and then you'll have more detailed images for the coronals and sagittals, and that's for a bone. But we're not looking for a bone for this scan, right? It's actually soft tissue. So normally soft tissue is with the protocol that says CT pelvis with contrast, but we're not giving contrast. So is it okay to select it? Yes, absolutely. It is okay to select CT pelvis with contrast to do a CT pelvis without contrast, because what we're actually targeting is the algorithm. We want the soft tissue algorithm to read soft tissue and not bone. So you'll select the CT pelvis with contrast, and most of the time those protocols have a bone window in it, but not all the time. And if not, you just build it into it. So you'll select the CT pelvis with contrast, and then what you can do is just turn off your contrast, turn off your delay time, so you have no delay time. You don't have to wait the 70 seconds, 60 seconds, whatever they built into it. It's just you want that algorithm of soft tissue. That's the whole reason why we're selecting CT pelvis with contrast. And this works for anything else, just like extremity or your knee or your foot. If they're ordering something for infection and the person's allergic to contrast, then what you would select is the CT soft tissue or CT with contrast, and then turn off your contrast, turn off your delay, and then do that. Or there's another option. There's so many options. There's so many ways to go around this. Or you select the without contrast, and then you turn on the soft tissue window. You add the soft tissue onto the protocol and have it build, or scan the soft tissue. Scan the bone window, like the without, and they give you bone, and then you can go reconstruct it after. So there's so many ways. You use your raw data, you use whatever that's built into it already. But my whole point is, read your reasoning why you're getting the scan. Know that you're doing the right thing for the patient, and the right order is ordered. So yeah, hopefully that provides some information. And I know I'm just like rambling on, but hopefully you like followed along. Okay, remember, follow your protocol, whatever protocol your facility has, do that. But yeah, toodles noodles. Stay radiant, radical, amazing. Okay, bye.